I'm going to take you on a bus ride. The bus ride is, who are you, who am I, and where are we going? The short version is they get on the bus in Los Angeles and they're headed to the East Coast. And overnight in Denver, and then after Denver, they get up, they're getting on the bus. The guy says, how far is Washington, D.C.? And the guy says, we're not going to Washington, we're going to New York. The lady says, no, we're not. It's St. Augustine, Florida. That's the East Coast. So where are we going? That's the point. Okay? My point is a little different than most dentists. What do you say to the knucklehead dentist you were talking about? Get your face out of the checkbook and start looking at the patient's heart. So how do I get in xylitol? In 2002, I'm in New York at an academy meeting. Some guy from Pocatello, Idaho was talking about chewing gum for kids that stops decay. I said, are you kidding me? So I'm back to Gaylord, Michigan, and the anesthesiast's wife was a speech therapist, bored to death. They'd moved in there and there's no jobs for her. So knowing she was academically orientated to the mouth and stuff, I said, you know what, Sharon, I'll tell you what, I'll give you $10 an hour. Look up stuff you can find about xylitol. So I went back to my chest, I'll give you $10. So every couple months I'd meet. In the fourth month I saw her, she had a binder for me. It was this thick with 106 references and highlighted areas, and her kids were on xylitol. And I hadn't spoken to her about xylitol. So now I think this is probably pretty serious, that she knows what's going on. So that's how I got introduced. I have a curiosity story my mother tells. Thank you, Mother. She said, speak slow and don't mumble. I was in four-year-old in the backyard with a dead bird and a paring knife. And she said, what are you doing? I'm saying I'm getting his whistle out. Because I figured you got to have a whistle in there. If I can get it out, I can blow on it and sound like a bird. So I have a curiosity beyond reality. So I will tell you why I get in certain things, okay? One of the biggest things I have is different from a lot of dentists, that I see a whole bunch of underserved people. And those are the statistics, and you can see them. 7 times more of this, 5 times more than that. Poor children have 2 times the number of cavities, and they have 51 million days lost in school from dental disease. We had 2 patients that I'm aware of. One was in Mississippi, and another one, that happened to be law cases, died of dental infections. Tooth decay in my realm is there's 3 factors that you all know. There's the age, the fluoride, blah, 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 the nutrition, and the flora, which is the strep mutans, which is the bad guy, and then what Brian talked about. Substrate is the oral clearance, things of that nature, saliva, and frequency. Frequency is probably one of the most important, but I want you to watch as we go through, especially you young mothers, about what happens with children that have strep mutans. So we found out it's an infectious disease. It's not brushing or flossing that stops tooth decay. You know, I tell parents, you know, write this one down. Put 14th to the 9th to the 9th power. That's 9 zeros after 14. That's how many types of bacteria you have on your body normally. 9 zeros after 14. Now, all of you that showered well this morning, the bacteria are smiling and saying thank you. They live in certain places and they do good things. If they get moved around where they don't belong, from picking here and picking there, that's when you got diseases. And when you get diseases that don't like being where they are, you got a problem. So that's some of the things we get with these kind of problems. Now, it's transmitted, we've seen, from caregivers, mothers generally. It can be other caregivers. And other recent studies have shown it happens in some of the early Head Start centers or preschool centers where you have kids playing with kids, and they pass the toys and they leave the toys and they put the toys in their mouth. Now, it has to be, it's not like, you know, AIDS. When AIDS came out, we all had to wear gloves now. I was back in the years when there was no gloves. It was $3 on top of the tooth and $4 for the side of the tooth, the fillings. There was no insurance. It was interesting then. Anyhow, along those lines, we'll find that we got the idea that you don't brush well, because when I went to the dentist, it was just horrendous as a kid, you know. And it was a bus ride downtown Detroit. There weren't any dentists in those suburbs. So I have an unusual upbringing in inner city Detroit for years. I really love my situation because I had a lot of opportunities to see, because my mother was a nurse, but my father was gone in the military for 6 years while I was growing up between 4 and 10 years old. And so I got a lot of maternal sides of me from learning just by accident, hanging around. Now here you can see how things can transmit to the baby's mouth, you know. Mama's loving the kid, we love the kids, we take a bite, say you take a bite. If you do it frequently enough, you will transmit bacteria. And now, what they used to call baby bottle mouth, are most of you familiar with baby bottle mouth? You know? And now they call it early child caries because they eventually academies name things, you know. And you can see the little hole in the tooth in the front. I don't know about the lighting, but the other teeth in the front, right up at the top, there's, oh, here's a pointer they told me. Is that right? Up here? This is a little white chalky area, and that's the beginning of decay. Here's decay. 2 kinds of bugs, and my strep mutans cracked open the shell, and lactobacillus said, this is a nice place to live. And they live in there and they eat the inside of the tooth rapidly. And then it advances. It doesn't stop. Now the child has the bug. You're not supposed to have it in your oral cavity until you're 5 or 6 years old. And it helps with table food, okay? So it is rampant. I do want you to see a couple of things that fascinated me early. There is no decay in the lower front teeth, okay? And tremendous decay up here. And there were no second molars in that patient, so the patient was only like 18 months old. This is a more advanced stage. Now, this little area, as you can probably see up here, this is an abscess draining. Those are broken off teeth with infectious axways into the soft tissue. This is more severe. All of the nerves are exposed on those teeth. The teeth don't hurt the children, you know, because the nerves are infected and died, unless you get a swollen face or something. And this tooth is very, very rare to be infected at this stage as a primary cuspid. You know, and they generally don't come in until 20, 24 months old. Look how advanced that thing is at this age. Here's a cellulitis. It was a hospital program. They thought it was a sinusitis, and they thought it was an eye infection. They treated her for 6 or 8 weeks. Actually, it was more than that. It wasn't happened to be at my hospital. And the child lost a sight in one eye from a dental first primary molar. So prevention targets, as you've probably seen a lot of these over your life in the fields you're in. Okay, mine is education, but education is very difficult. Like when they told me chewing gum will stop tooth decay, I didn't buy it. You can go into the dentist's office and say, well, this is going to save you. Well, what's it going to save me? I don't see those kids. I don't see this problem. Because you live in Birmingham, Michigan, or Grosse Pointe, Michigan, where the Fords live, and nobody has dental disease there because they haven't had passing on bacteria. All the people in underserved think it's a genetic trait. Oh, we've always had bad teeth. You'll hear things like that. So I ended up in a community health service for the last number of years of my program for 10 years. This is a case from a resident we did in the hospital. And John was from Boston. He talked, worse than me. So anyhow, I said, John, you can't talk to that. It's expensive. So I said, look up the case. This is 1995, I think it was. This is the cost for one patient in the operating room, okay? It was $42 a minute. $42 a minute, 1995, that was a couple of years ago. These are just informational slides, and I hope you're going to get this somehow in a little presentation that's about, you know, developing teeth and when their stages they're developing at and when you can treat moms. And you really should be able to treat patients. You don't have to categorize them as this is that and that's that. You ought to be able to know about their background and what's forming and that kind of stuff. And saliva tests with oral exams, question mark. Brian, that was back about 10 years ago, question mark. And food types, sleeping habits. Everybody points somewhere else. Us professionals don't take the responsibility, but we say you didn't brush well, or you didn't do that. What we didn't know is how you're getting it. And so this was one of the reasons that they thought, well, moms are not treating them well. They feed them bad things down in the inner city. They give them Coca-Cola and chips. Well, they give them whatever they can afford, and that's what they get at. Water only. This is a dental exam for a 2-year-old, but I like this position because the mother can see the teeth. And so when we're doing an exam, she can see inside what's going on and stuff. Now, toothbrush is a short story. There's a cute little brush, and the fire department got one out of a throat of a little kid. It was a little teeny 3-inch brush. and the little one swallowed it. And it was like, any of the hygienists here, I've known one patient in one office, we turned on the air to spray off the tooth, and the metal thing came off, and the child swallowed it. It was a 13-year-old. Went to the ER, they took it out, came back. Anyhow, that was a teenager. They would do that, right? Okay. This toothbrush, I took these pictures myself on my cell phone. I want a little applause for that. Secondly, a friend of mine transferred it and put it in this program. I said, how'd you do that? But see how flexible it is over there? It's like a pacifier. You can chew on it, you can do whatever you want with it. Now the products are unbelievable that Spry has. Now I'll tell you a story. Now my son's a pediatric dentist and he works at St. Mercy Hospital in Pontiac. And I go to his office once or twice a month when he needs help or if he goes away and does something. Anyhow, he has a lot of Spry products, a lot of xylitol products and information. They don't push it. They don't talk to patients about that. You know, it's there and it's on display in a little glass case and stuff like that, you know. And the toughest thing I had in treating these patients, and they came from northern Michigan on the Upper Peninsula, was to tell the mother that she's involved in the problem. Now that was a heartbreak. I couldn't, if you came to me and you've been to 5 offices, nobody treated you, didn't have any money, I'm not going to say, well, look what you've done. You know what I mean? People do that. They used to say things to parents like that. You didn't brush, you didn't do this and stuff. So that's the problem. The other thing is, we have to convince people. When you convince people, you have to have, you know, a couple of things. The big C is communications. There were no communication to underserved people from the students that came work with me in northern Michigan. They didn't understand poverty at all. And that is tragic in our society, if you're going to treat them. If you're not, fine, stay away. You know, but that has to be something that you learn. The problem is that we don't take care of, and we like residents, and I want a resident with a heart. I don't want a 4-point student. We used to argue about that all the time. I want to see what the person's done as a child and what they did as coaching or had fun with people and stuff. Now this was our Surgeon General, remember Everett Koop, and he says if you don't have a healthy mouth, you do not have health. So that's the end of the cut down slides and presentation. So my ringer didn't go off. I'm sure you probably have questions, and I could talk forever, people tell me. My mother told me I didn't talk till I was 3, but haven't stopped since. And if you've had lunch with me, you'll find out that's true. Yes, ma'am.
In your practice with this new philosophy, how many of your kids never had tooth decay?
My kids?
Practice.
Oh,
I'm sure your own kids.
Never had. Rarely did I see anybody with no tooth decay. Rarely. But the practice was in an extremely low-income community. You know, I'll tell you funny, humorous stories in a way. There was one kid, 80 pounds, and he was about 4.5 years old. And I had to help him into the chair. And I was looking at his mom standing there. I said to him, it was just in early December, I said, what do you want for Christmas? He said, a chainsaw. I said, what? He said, a chainsaw. Mother said, oh, we live in the woods. And there's no roads out there. So all he ever sees is the lumber people coming in and cutting down trees. And wouldn't you always want to be something when you grew up? I could be one of those if I get a chainsaw. It shocked me when he said a chainsaw. The other one was we had a school program in Detroit. I taught in a hygiene school, and I said, you know, when you see the kids, you know, I like your outfit. Where'd you get the shirt? I like wear your hairdo. And this one hygienist came over, and this is the second year we were there, and I thought they got a chance to see underserved people. And she looked like she was going to faint. I said, are you all right? She says, yeah. I said, what happened? She says, well, I said, I like your hair. Who did your hair? Your mom? She said, no, Mom's in jail. She shot my father. This is a true story. And I didn't know what to say. And I said, neither would I. I'd say a prayer. I mean, but you know, that's the response to the question. I don't have a mom, you know, and I don't have a dad. And there's a lot of those today in those communities where there's, if you're from large cities, particularly in Chicago or Detroit and stuff, we have alternative schools for moms. Because they're pregnant in high school, and they go to the alternative school. So I go to the alternative schools. Now there's some people who will do what you ask them, or they're interested in their infants. I am impressed with them. You know, Where on the other end of society, I knew a father from Bloomfield came in, paid $7,000 cash to have his daughter done in the operating room. You know, but it was a very well-to-do family, but had some serious tooth decay, you know. So I've had a great experience in my life, and I love this program you guys have. I'm so enthusiastic being here meeting you folks. I've been dealing with it using it since 2002, and I really appreciate being asked to be here. So if you have any questions, I'm happy response to anything you do.
Dr. Delaney, I have a question. You had mentioned that you'd been in a dental office where they had a lot of xylitol products, but it looked like to you they were just sitting there on the shelf. What would you suggest to get an office activated and energized and getting it out to their patients?
Well, that's my son's office, one of them.
Well, I thought that's what you said. I didn't want to bring that up again, but...
And of course, he has 3 or 4 hygienists that rotate going in there, and they have all kinds of programs. And he's a terrific dentist and does a nice job and works with difficult people. He doesn't see Medicaid patients. That's his choice. When I went to practice with him, I said to myself, I remember being 45, and I don't want anybody telling me anything, especially my parents. Now, I think women get that more than others because I realize they communicate with mothers a lot over the years. So what I think you have to do is you really have to have a luncheon with slides, or if they have severe patients, see the patients. It did happen one time I was there and there was an assistant with me. I'll tell you 2 quick stories. And the assistant was looking, I said, wow, this kid looks like kids from Rogers City up north. You know, he must be had xylitol, their teeth are shiny. His dad was sitting there, he says, yeah, it's the best thing I've found. And I didn't know he was on xylitol. You could tell by looking at the teeth, you know. And that's impressive, but I think you have to be of that type of thinking.
Well, Xlear has an outstanding group of product educators all over the country. And they could be coming into dental offices. So you're saying that once they get a presentation, show them a slideshow, and educate them, that's the best way.
Yeah, and in the health departments today, we should have xylitol distributed to the pregnant women, or actually the 6th month after the baby is born, and get rid of the fluoride, which is in there. It's not doing anything for the kids, other than probably things we don't know yet, but we will know eventually with some kind of study. So that's my feeling on that. The difficult thing was someone that has xylitol. Thanks. You don't have to just have it if you have a bad disease. It does so many other wonderful things. One of the assistants had just thought I was shooting off my mouth about this gum, and she had a 2 or 3-year-old, and she came to me one day, and she says, you know, I have a problem. She had 8 ear infections. I said, really? She says, and I know, what about your stuff? And I said, well, I'll give you some to try. And, you know, so we work. 9 months later, she shows up, and she said, oh, I got a problem. I said, what's the problem? She said, well, we just ran out of the stuff, and I got another ear infection. I mean, that quick. I was impressed. She must have convinced herself, you know, because she's one of these people that are studied hard and do what they do. And so I really think we have to look at how we can be compassionate to the community. And when you say your community probably has a fair number of Medicaid patients somewhere, and there's probably not any services, because most of them didn't have 10 years ago dental staffs and stuff. So, but to get the people to use it, I think if you used information that some of the people here have that I don't have, about how healthy it can be beyond the teeth. You know, I think we're sitting in the back today, and if someone can talk about that for me, and I'm really interested in finding out what all it does beyond the teeth. Okay?
I think we'll hear more about that throughout the program. So, thank you very much, Dr. James Delaney.
How'd I do?
Very much appreciate.
I have 2 minutes left.
Got 2 minutes left.